right. Hello, everyone. I'm Lauren, and this is Damon, and we are two of the UNCG Dietetic interns this year. And today we will be recording this presentation for you guys about food as medicine. So the first thing we're going to go through is the outline. And first we have food as preventative medicine. Then we'll talk about food as medicine for specific conditions. And then we'll end with a little information about food as medicine in relation to food security. So for our two objectives today, we have to identify the meaning of food as medicine, identify foods that aid in disease prevention and treatment, identify how food as medicine is used for different conditions, and then we'll have time for conclusion and some questions. So first we have the philosophy of food as medicine. So medicine is a philosophy where food and nutrition aid individuals through interventions that support health and wellness. Food as medicine is a reaffirmation that food and nutrition play a role in sustaining health, preventing disease, and as a therapy for those with conditions or in situations responsive to changes in their diet. So the studies show that about more than any other risk factor, about 1 in 5 deaths across the world is related to suboptimal diet. So this is where food as medicine kind of came about. And some, in general, food as medicine interventions include things such as therapeutic diets and healthy food prescriptions. So kind of a disclaimer we wanted to give before we get into all the information is that food as medicine in disease management and treatment is not to undermine any medical advice that you have been given. So food should be used to promote health in combination with necessary medications and is not meant to undermine the importance of prescribed drugs. So food cannot cure all diseases, as we know. You should work with your medical team to determine the best outcome, including working with your medical doctor, physician's assistants, dietitians, and anyone else who may be involved in your care. And the same foods, and so just the basics of food as medicine for prevention is the same foods used in disease treatment can also be used in prevention. So really wanting to focus on treating the whole person instead of just the disease symptoms to reduce the risk and the amount of these diseases that we're seeing in the world before they even come about. And so following a healthy diet is proven to lower your risk for a lot of the diseases that we're going to be discussing later. So for prevention, I think, Damon, do you have this slide?
That is my slide. I'll take over. All right, thank you. As mentioned before, adherence to treatment recommendations from your primary care provider is critical to managing disease. However, there are numerous ways that our dietary choices can impact health status and outcomes. Cardiovascular disease is an umbrella term for illnesses that affect the heart system. Stroke, heart attack, and heart failure all fall into this category. According to the 2021 American Heart Association's heart disease and stroke statistics, between 2015 and 2018, over 126 million American adults had some form of cardiovascular disease. In 2019, cardiovascular disease accounted for over 18 million deaths globally. Initiatives such as Million Hearts 2022 are aimed at preventing 1 million incidents of heart attack and stroke within 5 years. Remember, prevention is key and should include at least 2.5 hours of moderate aerobic exercise per week. Activities can range from walking, dancing, to daily activities like shopping, vacuuming, or playing physically interactive video games like tennis or bowling. Next slide. Maintaining a healthy body weight is a very important step in disease prevention. When body weight is in a healthy range, you improve your blood circulation, you improve your energy, and your overall mood. Hydration status is easier to maintain, and you reduce the chances of developing diabetes, heart disease, and breathing complications. Meal planning should focus on diversity, variety, and nutrient density while maintaining caloric limits. Phytochemicals are substances found in fruits and vegetables that may contribute to improved health and wellness overall. Next slide.
All right, so a little more information about phytochemicals. So these are chemicals that are present in plants like fruits, vegetables, grains, and beans. And research does suggest that cancer risk can be reduced by 40% by increasing consumption of phytochemicals in the diet. And it does this by stopping the formation of cancer-causing substances or carcinogens and stops them from attacking cells in the body. So we have this little graphic here that they contribute to antioxidant activity, cancer-preventing compounds, interference with DNA replication, antibacterial effect, reduced bioavailability of nutrients. And here's just a little helpful chart with the different colors that are related to phytochemicals. So red we see as being with lycopene, which is in your strawberries, cranberries, raspberries, tomatoes. And this is a very potent antioxidant, protects against cardiovascular disease, diabetes, and cancer. And then we have orange and yellow, which is beta cryptoxanthin. And we're going to see that in butternut squash, pumpkin, tangerines, bell peppers, carrots. This is preventative against cancer and osteoporosis and immune function and eye health. Green, we have sulforaphane, which is in cruciferous vegetables for cancer prevention, cardiovascular disease, and neurodegenerative diseases. And lutein, which is in the dark leafy greens, which protects against diabetes, cataracts, macular degeneration, and cognitive decline. So that one's really associated with health in your eyes and things like that. Then we have blue, purple, and black vegetables, which are the flavonoids, blueberries, blackberries, grapes, plums, figs, prunes, powerful antioxidants, protect against cardiovascular disease. And white, we have the onion family, chives, garlic, prevents against cardiovascular disease and obesity. And so this is where you're going to want to really focus on, just making a colorful plate and adding in all of these nutrients with that. And I also wanted to point out that there is no evidence so far to suggest that taking phytochemicals in supplement form is beneficial, and it is recommended to consume them in the diet for optimal benefits.
All right, healthy benefits of culinary herbs and spices. So herbs and spices contain beneficial substances and can be used as culinary substitutes for salt, an additional added salt in your meals. Many of these substances are known to be essential for health, such as vitamin A, vitamin C, and iron, which can be found in basil, vitamin K, which can be found in sage, and potassium and vitamin C, which can be found in rosemary. Popular spices such as dried peppers, cinnamon, turmeric, cumin have also been shown to have health promoting properties. These include support for digestion, support for metabolism, circulation, and the reduction of inflammation. Next slide. All right, food as medicine and disease management and nutrition. So as mentioned before, there are many ways that our dietary choices can assist in the prevention and management of disease. Common diet-related illnesses include diabetes, hypertension, and heart disease. These diseases in particular can be greatly impacted by choosing to meet nutritional needs with nutrient-dense foods and beverages, as well as monitoring your portion sizes. Next slide. All right. The American Heart Association recommends a heart-healthy diet that is based on lean meats, fruits and vegetables, reduces sodium intake, and provides these foods in an abundance. This should also include low-fat dairy or soy-based products. This should also include polyunsaturated oils, such as olive oil and canola oil, and foods rich in omega-3 fatty acids such as salmon, cod, and trout. Remember to limit saturated fats and tropical oils and also sugary drinks. Do most of your shopping on the perimeter of the market and fill your cart with whole foods while limiting processed products that are found in the interior aisles. Next slide. All right, cardiovascular disease continues. So healthy eating plate, we want to make sure that we are eating according to the diagram that is posted on the PowerPoint. So large amount of vegetables, 60% fruits, whole grains, healthy proteins, very important. Remember to hydrate as necessary throughout the day, never waiting until you are thirsty. Always hydrate periodically. So recommendations, regular exercise, healthy eating patterns, of course. Again, foods to include fruits and vegetables, whole grains, nuts and seeds, fish and poultry, and vegetable oils. These things have shown to reduce the risk of heart disease, stroke, and diabetes. Next slide. All right, so food as medicine in disease treatment. So diabetes is a condition that causes blood sugar to rise and can lead to serious medical problems such as cardiovascular disease. Type 2 diabetes is the most prevalent form and has been diagnosed primarily in adults. In addition to following the recommendations prescribed by your primary care physician, you should aim to keep a healthy balance of nutrient-dense foods in your meal and practice portion control to effectively manage blood sugar. The diabetes plate method is a program promoted by the American Diabetes Association that provides tips to easily prepare perfectly balanced and proportioned meals. Remember again to include effective hydration throughout the day. Next slide. So on to the DASH diet. So food as medicine in disease management and treatment of hypertension. So the DASH diet, or dietary approaches to stop hypertension, is indicated for individuals who need to control their sodium intake. It is used for the prevention and controlling of high blood pressure and focuses on consistently consuming a number of servings of specific food groups throughout the day. This can include lean meat, poultry, fish, nuts, legumes, beans, whole grain, and complex starches such as sweet potatoes. Next slide. So here we see a representation of some of the foods that are included on the DASH diet. So we have avocados, we have dark chocolate, we have bananas, again, sweet potatoes, different types of nuts, and spinach.
All right, so we just wanted to get into the Mediterranean diet a little bit. So this diet can be beneficial for a wide range of conditions, and it focuses on low in saturated fat, low sodium, high in omega-3 fatty acids, and also a focus on balancing the omega-3 to omega-6 fatty acid ratio, which is proven to be anti-inflammatory, and a focus on fruits and vegetables and whole grains. And this is also the primary diet choice for anti-inflammatory conditions. So we want to focus at the bottom here of the pyramid with daily exercise and weight control, whole grain foods and plant oils, vegetables and fruits, and as this says, vegetables in abundance. So then we're going to really increase that phytochemical amount in your diet as well. Then we have nuts and legumes, fish, poultry, and eggs, dairy or calcium, red meat and butter, and things like white rice, white bread in moderation. And then also alcohol in moderation, and multivitamins for most people would be acceptable as well. And all of these conditions mentioned previously can benefit from this diet in some way, just wanting to make sure to make the modifications for your specific disease state. And here we have some information about nutrition security. So food insecure is defined by healthy people as a disruption of food intake or eating patterns because of lack of money or other resources. And I had just a quote from a study saying that changing lifestyle risk factors could prevent most cases of cardiovascular disease, stroke, diabetes, and some cancers among high-income populations, which is really important to note that it says high-income populations. So hunger and health go hand in hand. 66% of American households have to choose between food and medical care. This is really important when recognizing food as medicine is intended for oftentimes disease states. So if you are struggling with a disorder such as diabetes, but then you're having decreased access to food, that's something we want to really try to help with. So we need changes in education, food policy, physical infrastructure to support this philosophy in treating food insecurity and related diseases. So here we just have some food resources in the area of Greensboro, High Point, Winston-Salem. So Out of the Garden project, this has a fresh mobile market with a mobile food pantry distributing fresh produce, meat, and other items. This is on a monthly basis in the Greensboro, High Point area. And then we have One Step Further. So this is a community support nutrition program. And some of the programs that they offer, Lunch and Learn, which is essentially a program where you go in and have like a cooking event and you can talk about health and wellness in that way, and Container Gardening series where participants will grow fruits and veggies that can be distributed to the public. And they also offer grocery assistance. And then we have Second Harvest Food Bank, has locations throughout North Carolina, with the main being in Winston-Salem, but we also have things in Greensboro and other locations as well. And then here we have our references.